So, emergency physician and member of the American College of Emergency Physician Board of Directors, Dr. Ryan Stanton, joining us today. Thank you so much for being here.
Thanks for having me.
Yeah, of course. So let's get right into it. We're talking about misinformation. We've been seeing so much misinformation, and that's kind of what we do here at Verify, is try to, clear up that misinformation. So can you tell us a little bit about some of the misleading vaccine information that you're seeing?
Yeah, unfortunately, it's one of the biggest challenges we as healthcare have faced throughout the pandemic, whether it is through social media, the Facebook or Twitter or whatever it may be, or even some news sources out there providing information that is false, misleading, some of it purposeful, some of it just misinterpretation of the data that's out there. But it's been a significant challenge. Many states suffering from low vaccination rates, and we're seeing that in the emergency department with patients coming in that are struggling with COVID-19, and the unfortunate reality is that many of them won't make it out of the hospital. So this is actually misinformation that is costing lives.
Yeah, and one thing that we keep getting into right now, into our Verify email, I should say, is that people are asking about boosters, and they're confused about boosters, and we even seem to be getting mixed information. Explain who can get a booster, and can they mix these boosters? Can they mix brands?
Yeah, with the boost. Oh, yeah. With the booster discussion, they're approved right now for over 65 and those that are in higher risk situation. That's the Pfizer. You're going to see probably coming up over the next few days that the Johnson & Johnson will be approved for a booster status. And that's going to be very important for those that are higher risk exposures, higher risk settings, especially for us in healthcare and the elderly that may not have a strong immune response. Here in the United States, they're recommending staying with the company that you had the first time, whether it be Pfizer, Moderna, or Johnson & Johnson. But we know with data from around the world that it is safe to mix the vaccines, and there's possibility that it may actually even boost that immune response. So there's no danger in mixing the vaccines, but the recommendation currently from the CDC and FDA is staying with the same company if you can.
All right, great. And another thing that we're seeing a lot, even on social media, is that this vaccine was rushed. What would you have to say to people who believe that the vaccine was rushed and people shouldn't take it?
The vaccine wasn't rushed at all. In fact, what it was done is probably what we should do for most medications, which is removing the red tape and the unnecessary hoops that delay the evaluation and approval of medicines here in the United States. All of the other information in terms of the studies, the rigor of those studies, the review of the information they produced, the good and the bad, the efficacy and risks, was the exact same as what would be expected. But it was actually just streamlining the process. And so these vaccinations now, especially with how many doses have been given worldwide, are some of the most observed and studied medications in the history of mankind. And we know that they're efficacious, and we know that they're safe. And they're our best tool against fighting COVID-19, which seems to be the pandemic that never ends. And we're wanting to get that over with so we can all get back to life.
And, we've been hearing a lot about breakthrough cases from people. Because of this, people are saying they don't need to get the vaccine. What do you have to say to that?
Well, there are breakthrough cases, and that's just a fact with most vaccines. You can have breakthrough cases, and we still see some risk among the elderly who don't have as strong a response to the vaccine. But the vaccine will still protect you and prevent about 2/3 of cases associated with the Delta variant, even higher prior to that, and still prevent about 90% of deaths. So for us in the emergency department, over 90% of the people that are presenting to us are unvaccinated. Over 90% that are admitted are unvaccinated. And less than 5% of the deaths nationwide right now are associated with those that are fully vaccinated, and those tend to be in the very high risk range. So not only is it protective, it is significantly protective, and even though there can be breakthrough cases, it's still a much better option than just letting nature take its course with COVID-19.
Okay, so the vaccine helps protect you from COVID-19, but does it help you from spreading it to others who are too young or unable to get the vaccine? That's what many people are saying, that, the people who do have the vaccine are spreading it more than people who don't have the vaccine.
Well, they're definitely not spreading it more because since it prevents 2/3 of cases, that's only 1/3 of the opportunity to spread it comparatively. So there is still potential that you can spread it, especially if you get a symptomatic case. Now that it's not felt, there's a huge risk with completely asymptomatic, but anytime, even with fully vaccinated, that you have any type of symptoms, changes, which is a little bit difficult now during the time of year with a lot of allergies that are out there, you need to get tested and take those basic steps to protect yourself and protect those around you. The challenge is that with that narrative is the fact that you can still spread it if you get COVID-19, but it is not near the risk of getting COVID-19 and thus spreading it as being unvaccinated. So to me, that is not an excuse to get it. In fact, what we're seeing in most cases is that somebody unvaccinated within the household is actually spreading it to others in the household and even those that may be elderly and fully vaccinated. So it's still going to be a significant burden on the unvaccinated, even though you still need to be very careful once vaccinated to monitor for symptoms.
And before you go for today, what is one thing that you really want people to know or understand?
What I want people to realize is that with viruses, we are not good in healthcare and never have been at treating viruses once people have them. But we are pretty darn good at preventing them from happening altogether with vaccinations. And that is just the case here with COVID-19. Our best tool in this fight of this pandemic that we all want to see end is the vaccine. And we need everybody out there who is a candidate and able to get the vaccine so we can protect ourselves, protect those around us, and protect those that are going to be higher risk. Because that's how we get through this, that we finally flatten, break out of that curve, and move on with our lives.
All right, great. Thank you so much for joining us today, Doctor.
Thank you.